the whole problem with what we've done with Big Pharma, and when Big Pharma goes in and they've found a plant that's worked for years to treat something. I like to use the example of white willow bark. White willow bark is one of the first plants that a big drug company, Bayer Aspirin, isolated acetylsalicylic acid. They isolated aspirin out of white willow bark. And they knew that Native Americans were using white willow bark to treat fevers, to treat inflammation, to treat pain, things like that. So they isolated the active ingredient out of it. Well, we don't know what we don't know. So we're just looking for this magic ingredient in there. So we say it's aspirin and acetylsalicylic acid. And then all of a sudden we give people aspirin, their ears are ringing, their stomachs are bleeding. They're having all these, kidney side effects, all these side effects where white willow bark never caused that. Well, why? Because white willow bark has other ingredients in there that might work synergistically and also might work to decrease the side effects. We only know what we know. So we don't know what we're not looking for. You know what I'm saying? It's hard to explain, but it's actually the paradox of Big Pharma trying to isolate an active ingredient out of a plant.
Yeah, I agree. That we've taken something that was given to us naturally and, I don't know, just taken pieces of it, thinking that we're smarter than nature.
Right.
And we're not.
And there's example after example of drugs that we can use, because most drugs still come from plant sources. Some kind of natural source, but there's always a problem when we try to isolate that active ingredient from a plant source.